Hi everyone, Dr. Michelle Mian here. What we're going to talk about right now is a crossbite, either of a single tooth in the front or of teeth in the back. Okay, so let's take the example of a coffee cup with a lid over it. In general, in order for the lid to fit and function properly, it needs to be a little bit wider or bigger than the top of the cup. If, for example, we had a lid over this coffee cup that was not wide enough, it wouldn't form a functional seal and coffee could spill out. It wouldn't function properly. So I want us to think about top and bottom teeth in a similar way. In general, we want the width of the top jaw to be wider than the width of the bottom jaw so that all of the top teeth can fit outside of the bottom teeth. So we can see that this bottom jaw is not quite as wide as the top jaw. Now here's an example where that's not the case in two places. So first, we have a front tooth that's tucked behind or sitting on the inside of the bottom tooth. And then we have some back teeth that are tucked back behind there, not on the outside of the bottom teeth. And that's because the top jaw is more narrow than the bottom jaw. These are called crossbites. When it's in the front or the anterior, we call it a front crossbite or an anterior crossbite. When it's in the back, we call it a posterior crossbite. Now, top narrow jaws are quite common. We can see them in famous Olympic swimmers. We can see them in other kids in our classes. So it is a very common feature. Now going back to our example, with the front tooth crossbite, we have a risk of trauma to that tooth because we may be biting down on it or adjacent tooth to it. And then when we do that, we might shift our jaw because we're having trauma, we're not biting in a comfortable position, so we move our jaw when we close to bite in a different position. Now with regards to the back crossbite, we can look at the centers of these teeth. Do you see how the center of the top and the center of the bottom teeth are not aligned? Well, with the back crossbite, we have a risk of the jaw shifting when we close because it's closing in an uncomfortable position, and we may shift it to the right or to the left in order to make a more comfortable bite. And if that happens over time, sometimes we can get asymmetric jaw growth, with there being more growth on one side versus the other. Now, I don't know the cause of this famous CNN anchor's asymmetric jaw growth, but we can see that one side of the jaw here has grown more than the other side of the jaw here, and that's something that we want to try to avoid. So treatment for these sorts of crossbites can be an expander or full or partial braces.
Thanks for your attention. If you have any questions or would like to check out our website for more videos on different conditions or treatments, please check out meonorthodontics.com.